Close your eyes for a moment. Picture yourself lying on a wooden table. The year is 1846. There's no anesthesia coursing through your veins. No gentle countdown from 10 to 1. Just you, a surgeon with hands that smell of tobacco and death, and a saw that's about to change your life forever. You can probably feel your heart rate picking up just thinking about it, can't you? That's your modern brain trying to process what medicine used to be, what it had to be before we learned better ways to heal. So before we begin this journey into the darkest corners of medical history, take a moment to like the video if you're curious about what we'll discover together. Subscribe if you want to explore more mysteries of science and human survival. And let me know in the comments where you're listening from tonight. What drew you to this topic? Are you fascinated by medical history? Or do you just enjoy falling asleep to stories that make you grateful for modern healthcare? Now get comfortable. Dim the lights if you'd like. Maybe grab a warm drink. And let's ease into tonight's exploration of the tools that once defined the thin line between healing and harm. Picture yourself as a Civil War soldier. You've taken a musket ball to the leg. The bone is shattered like dropped china. The field surgeon approaches with what looks like a carpenter's tool because, well, it basically is. The bone saw, jagged teeth arranged in a perfect line, each tooth designed to bite, tear, and rip through whatever stands in its way. In your case, that's your femur. You might think the surgeon would take his time, be gentle, work with precision, but you'd be wrong. Speed was everything, not because they cared about your pain, though some did, but because the longer you stayed on that table, the more likely you were to die from shock, from blood loss, from the sheer trauma of what was happening to your body. So the surgeon would work like a lumberjack in a competition. Back and forth, the saw's teeth grinding through bone with a sound you'd never forget. If you lived to remember it, the sawdust would mix with your blood, creating a paste that stuck to everything. The surgeon's apron, the wooden floor, sometimes even the ceiling. When things got particularly energetic, you can almost hear it, can't you? That rhythmic scraping, like someone filing their nails, but magnified 100 times. And wet, always wet. The pile of limbs would grow throughout the day. Arms and legs stacked like cordwood outside the medical tent, a monument to surgical efficiency and human suffering. But here's the thing that might surprise you. Many patients survived, not most, but many. The human body's ability to endure trauma is remarkable, almost supernatural. The bone saw wasn't elegant, it wasn't precise, it was brutal, efficient, and surprisingly effective, like using a sledgehammer to crack a walnut. Messy, but it got the job done. These surgeons weren't monsters, they were doing the best they could with what they had, working by candlelight, without antibiotics, without understanding of infection, just raw determination and sharp steel. The saw would bite through bone in maybe 30 seconds. If the surgeon was skilled, if the bone was soft, if you were lucky. But bone saws were gentle compared to what came next. Tools that didn't just cut through your body, but bored straight into your soul. Imagine you're in medieval Europe. Your head has been pounding for weeks. The pain feels like someone's driving nails behind your eyes. The local surgeon has a solution. He's going to drill a hole in your skull to let the evil spirits out, he says, to relieve the pressure. The trepanation drill looks innocent enough, like something you'd use to open a coconut or start a campfire. Just a simple hand-cranked device with a sharp, circular bit. But that bit is designed for one purpose: to grind through the hardest bone in your body, your skull. the fortress that protects your most precious possession. You'd lie there, fully conscious, because unconsciousness was a luxury they couldn't afford. They needed you awake, responsive, so they'd know when to stop drilling. The surgeon would place the bit against your scalp, find just the right spot, usually somewhere on the side of your head, away from anything too obviously vital. Then he'd start cranking, slow at first, testing the resistance, finding his rhythm. The sound would be unlike anything you'd ever heard, a grinding, scraping noise that you'd feel as much as hear. It would vibrate through your entire skull, like having construction work done inside your head. Bone dust would start falling, white and gritty, sometimes mixed with blood from the scalp, creating a paste that the surgeon would have to clear away periodically, so he could see his progress. The drilling would take time, maybe 20 minutes, maybe an hour, depends on how thick your skull was, how skilled the surgeon, how much pain you could endure before passing out. But here's what's truly remarkable. Archaeological evidence shows that many people survived this procedure, more than half in some studies. You can tell because the bone shows signs of healing around the holes. Some people even came back for seconds, multiple holes drilled at different times, like they were collecting them. The surgeon would know he was getting close when the bone dust changed color. When it started coming up darker, wetter, that meant he was almost through to the soft tissue underneath. One more turn of the crank, maybe two, and then breakthrough. A perfect circle of skull, removed like a cork from a bottle, exposing the brain beneath, pulsing, alive, vulnerable. Sometimes it worked. The pressure was relieved, the headaches stopped. The patient lived a normal life with their new window to the world. Sometimes it didn't. Infection, bleeding, damage to the brain itself. Death came quickly or slowly, depending on what went wrong. But they kept trying, generation after generation, drilling holes in heads with the same confidence we have when we take aspirin. Because the alternative was watching people suffer, watching them die from something that might, just might, be fixable with the right tool, applied in the right place, by someone brave enough to try. The drill would eventually evolve, become more precise, more controlled, but the basic principle remained the same. Sometimes to fix what's inside, you have to break what's outside. Even today, surgeons still drill holes in skulls. We just call it craniotomy now. And we use anesthesia and sterile conditions and computers to guide the drill. But it's still the same basic idea, the same leap of faith, the same trust in steel and human skill to make things better. One hole at a time. Imagine you're about to become a parent. It's 1750. Your wife has been in labor for 18 hours. The midwife looks worried. She's seen this before. The baby is stuck, turned the wrong way, too big for the passage nature provided. Without help, both mother and child will die. The midwife knows this. You know this. Everyone in the room knows this. So she reaches for her leather bag, the one with the metal instruments, cold steel shaped like giant salad tongs, obstetrical forceps, designed to grab what nature can't release, to pull life from the edge of death. But these aren't the gentle, precise instruments you might imagine. These are crude, heavy, built more like medieval torture devices than medical tools. Each blade curves inward, designed to cup a baby's head like two metal hands. When locked together, they create a cage of steel around the most fragile thing in the world. The midwife would slide them in carefully, one blade at a time, feeling for the right position, trying to cradle rather than crush. But there was no ultrasound, no way to see what she was doing, just experienced hands working in darkness, guided by touch and prayer. Once both blades were in place, she'd lock them together. The handles would meet with a metallic click, like handcuffs closing or a trap snapping shut. Then came the pulling. Steady, firm pressure, timed with the contractions, working with the mother's body, not against it. You'd hear the mother screaming from pain, from effort, from the terror of knowing her baby's life hung in the balance of these metal jaws. The forceps would leave marks, dents in the baby's soft skull, sometimes permanent, a lifelong reminder of their violent entry into the world. But many babies survived, more than you might expect. The forceps were brutal, but they worked. They turned certain death into possible life. The successful deliveries were miraculous. A baby who should have died, breathing, crying, pink and perfect despite the trauma. The failures were devastating. Crushed skulls, broken necks, mothers who bled out from internal injuries caused by the metal intrusion. But the midwives kept using them because the alternative was watching everyone die, standing helpless while nature claimed both lives. Some forceps were works of art, engraved handles, polished steel, passed down through generations of birth attendants like family heirlooms. Others were crude, hammered out by local blacksmiths, rough edges filed smooth by use, each pair unique in its own terrifying way. The procedure could take minutes or hours, depends on how stuck the baby was, how strong the mother, how skilled the hands holding the instruments. Modern obstetrics still uses forceps sometimes, but they're different now. Lighter, more precise, used as a last resort rather than a first option. We have vacuum extractors now, cesarean sections, ways to bring life into the world without relying on medieval tongs. But for centuries, those crude metal claws were the difference between life and death. The thin line between joy and tragedy. Cold comfort perhaps, but comfort nonetheless. Now picture this, your brother has been shot. The year is 1863, Gettysburg. The bullet is lodged somewhere in his chest. Too deep to see, too dangerous to leave. But removing it might kill him faster than leaving it alone. The field surgeon examines the wound by candlelight. Blood seeps around the edges like a slow leak in a dam. He reaches for his bullet extractor, a long, thin probe with a screw tip designed to burrow into flesh like a mechanical earthworm. This isn't surgery as we know it, this is archaeology. Excavating metal from the ruins of a human body. The probe goes in blind. The surgeon guides it by feel alone, pushing through muscle, around bone, following the bullet's path like a bloodhound following a scent. You can almost feel it, can't you? That cold metal sliding through tissue, searching, probing, disturbing things that were never meant to be disturbed. Sometimes the surgeon gets lucky. The probe hits metal immediately. A solid clink that means the bullet is right there, waiting to be claimed. But usually it's harder. The bullet has fragmented, scattered like shrapnel through the tissue, or moved from its original position, pushed deeper by muscle contractions. So the surgeon has to hunt carefully, methodically, like a blind man searching for a coin in a dark room. The probe has tiny jaws at the tip. When it finds the bullet, they clamp down, lock into place, create a connection between the metal inside and the hand outside. Then comes the extraction. Slow, steady pressure, not too fast, or the bullet might slip away. Not too slow, or the patient might die from the trauma. The bullet comes out covered in blood and tissue, sometimes in pieces, sometimes whole, always accompanied by a gush of fluid that's been trapped behind it. Success rates were unpredictable. Some soldiers walked away completely healed. Others died from infection days later. The body's response to the violation was always a mystery, but here's what's remarkable. The human body can survive incredible trauma, bullets in the heart, the brain, places that should be instantly fatal. Yet some people lived. The extractors themselves were elegant in their simplicity. Long, thin tools that looked more like fishing equipment than medical instruments. Some had telescoping handles. Others came in sets, like nested spoons. Each size designed for different depths, different types of wounds. The best surgeons developed techniques, ways to angle the probe, how much pressure to apply, when to stop digging and leave the bullet alone, because sometimes the extraction was more dangerous than the wound. Better to leave sleeping metal alone than wake it with clumsy fingers. Modern surgery has made bullet extraction almost routine. X-rays show exactly where to look. Anesthesia keeps patients still. Sterile conditions prevent infection. But for centuries, removing bullets was like defusing bombs. One wrong move and everything exploded. The surgeons who did this work weren't heroes. They were just people trying to help, using the tools they had, making the best decisions they could with incomplete information. Sometimes they saved lives, sometimes they ended them, but they always tried. In a world full of violence, they were mining for hope. One bullet at a time. It's 1950. You're visiting a psychiatric hospital. The doctor seems confident, professional. He talks about a new procedure that can cure mental illness. He shows you his instrument, an ice pick, the same tool your grandmother uses to chip ice for cocktails. This is going to fix your loved one's mind, he says. Simple, quick, revolutionary. The lobotomy ice pick, perhaps the most horrifying medical tool ever created. This wasn't medieval barbarism. This was modern medicine, practiced in clean hospitals by educated doctors with the best of intentions. The procedure was almost casual. The patient would sit in a chair, wide awake. The doctor would lift their eyelid, find the thin bone at the top of the eye socket. Then he'd push the ice pick through, up into the brain. With no more ceremony than opening a can of paint. A few quick movements, left to right, severing connections in the frontal lobe, the part of the brain that makes you, you. The patients often stayed conscious throughout. They could talk, answer questions, describe what they were feeling as their personality was being surgically altered. Some reported immediate changes. The voices stopped. The anxiety disappeared. The rage evaporated like morning mist. Others just went away. Their bodies remained, but the person inside was gone, replaced by something docile, compliant, empty. Thousands of these procedures were performed on children, adults, anyone whose behavior inconvenienced the people around them. Homosexuals, difficult wives, rebellious teenagers, depression, schizophrenia. Sometimes just persistent sadness was enough to earn you an ice pick to the brain. The doctor who popularized this technique won a Nobel Prize for medicine for helping humanity. That should tell you something about how desperate we were to fix broken minds, how little we understood about what makes consciousness work. The ice pick left almost no external mark, a tiny puncture that healed within days, but inside the damage was permanent, irreversible. Some patients improved, their symptoms genuinely decreased, they lived calmer if diminished lives, but many were destroyed, turned into living ghosts, present in body but absent in spirit. Families were told their loved ones were cured, fixed, better than before, and they wanted to believe it, needed to believe it. The procedure was eventually abandoned, not because it didn't work, but because we realized it worked too well. It solved behavioral problems by removing the person who had them. Modern psychiatry has moved beyond the ice pick. We have medications, therapy, understanding of brain chemistry that our predecessors couldn't imagine. But the lobotomy reminds us of something important. The road to hell is paved with good intentions, and sometimes the most civilized societies commit the most barbaric acts. All in the name of helping, all with the best tools available, all while believing they were doing the right thing. As you drift off tonight, remember something. Every gentle medical procedure you've experienced, every pain-free surgery, every careful diagnosis, stands on the shoulders of these crude, desperate attempts at healing. Those surgeons weren't monsters, they were trying to help, with the tools and knowledge they had. In a strange way, their failures paved the road to our successes. Each brutal procedure taught us something about the human body, about pain, about the difference between helping and harming. So, as your breathing slows and your thoughts begin to wander, consider this. Someday, 100 years from now, someone might look back at our current medical practices with the same horrified fascination. What seems cutting edge to us might seem barbaric to them. That's how progress works. Slowly, painfully, one improvement at a time, one gentle breath at a time, until we drift into tomorrow's better world. Sleep well tonight, if you can, and be grateful for the soft pillow under your head, the quiet room around you, the absence of bone saws and ice picks and all the other tools that once defined the thin line between healing and harm. Sweet dreams. And remember, we've come a long way from where we started.